And we're back for part 2 of our posterior mediastinum whiteboard walkthrough. In this video, we're covering aortic branches, vagus nerve, esophagus, and the bronchial tree. Let's get into it. We've seen our thoracic duct, but that's a pretty deep structure, and I kind of was trying to go superficially deep, so we kind of had a little detour there, but that's okay. So our SVC, we now know about brachiocephalix, we know about the venous angle, we know about the thoracic duct dumping its lymphatic contents back into the circulation. And so now we can continue on. We've covered phrenic nerve. If we go deeper, we would see our aorta. We'd see the ascending portion cut, and then we'd see the arch of our aorta. And we can actually see those 3 vessels I kept talking about that are the branches of our thoracic aorta. Aorta is arching, giving off 3 branches. I've gone through them many times in the other videos. This is my right brachiocephalic trunk. This is my left common carotid, and this is my left subclavian. We need to know that my right brachiocephalic does branch into the same thing as these on this side. So I have a right common carotid, goes up into the neck. I have a right subclavian that goes off into the upper limb. So we're seeing that here is just covered up by our SVC and our brachiocephalic vein. So aorta is more left-sided, SVC is more right-sided. So that's why they're kind of overlapping each other. I'm going to continue its path down until it disappears behind the diaphragm. So aorta is ascending, arching, giving off those vessels, and then going down, right? This is our descending or thoracic aorta. Off of our descending or thoracic aorta, we have posterior intercostal arteries. That is where they come from. They come from directly off the aorta. Is these posterior intercostal arteries. You can see them branching off the aorta in this picture, and then they go behind the esophagus, behind those structures in the same plane as the azygous vein, which we will get to, and goes off to both sides. So these are posterior intercostal arteries branching directly from the aorta. We can see an orange structure coming down in front on top of the arch of the aorta, and then it's hard to see in this picture, but there is a little white structure here. Looks like it's connecting aorta to pulmonary trunk, and it is. This is a remnant structure, and it's related to this orange structure that is a nerve. Specifically, that's the vagus nerve. The vagus nerve and the phrenic nerve both come from the neck, essentially. We'll get into the specifics when we get to head and neck. But vagus nerve is one of your cranial nerves. Cranial nerve 10 comes all the way down into the thorax on both sides. But this side, the left side, it does something very specific that it doesn't do on the right side. And it's related to the aorta and the pulmonary trunk and this ligament between them. This ligament is called ligamentum arteriosum. And it is a remnant structure that used to be an open pathway between our aorta and our pulmonary trunk, because fetal circulation and adult circulation are vastly different. Without getting into the details, the lungs were not operational at this time, so our mother, through our umbilical vessels, was oxygenating our blood for us. So the way that you were getting oxygen as a fetus was through mom. So mom's giving you oxygen, which means your lungs aren't functioning in the way they function as an adult, where they give you oxygen and we do gas exchange on our own. Instead, we're getting it from mom's lung. And because of this, we have openings between different places that normally would have deoxygenated separated from oxygenated. But when things don't really need to go to the lungs in the same way, we have this open pathway, which used to be the ductus arteriosus, or arteriosum. So this is now a ligament because we developed and it actually shut like it's supposed to and became ligamentous, and now it is a landmark for us. So the ligamentum arteriosum is a taggable structure, but it's also a landmark so we can find our vagus nerve's recurrent branch. So the vagus nerve comes down from the neck, gives off a very specific recurrent branch called the recurrent laryngeal branch, because it's going to go back up. It's our thyroid gland and our trachea. It's headed to the larynx. So our larynx is up here with a thyroid cartilage and a cricoid cartilage. These are things you don't need to know yet. But these structures, that's essentially our larynx. The recurrent laryngeal nerve will wrap around deep to that ligament and go under the aorta and back up to the larynx on the left side. Now, why do I say on the left side so specifically? Because on the right side, it's different. On the right side, instead of recurring, so looping and going back up, on the right side, we don't do it around the aorta. There isn't an aorta on the right side. So instead, we loop around the other vessel from the neck down. That's going to be our subclavian. So our right subclavian artery is actually where our right recurrent laryngeal nerve loops, which is why you don't learn about it in thorax, you learn about it in head and neck. So in the thorax, though, a very identifiable, very taggable structure is going to be that left recurrent laryngeal nerve. And you gotta look for your ligamentum arteriosum, you gotta look for your vagus nerve on top of your aorta, and you'll see it looping away from the rest of vagus nerve. That is your recurrent laryngeal nerve on your left side. And it is a vagus branch. That was a lot of words. Okay. Vagus nerve then continues, as you can see, it goes behind pulmonary trunk, and it continues, and then it becomes a plexus. A plexus is a network of nerves, so it's like a net, literally, of nerves. And it gets onto the esophagus. So this brown structure back here is my esophagus, and this is my esophageal plexus of my vagus nerve. So my esophageal plexus of my vagus nerve, because it's the portion of the vagus nerve that goes to the esophagus. And the vagus nerve is so cool. The vagus nerve starts in the neck, right? Comes from the brain, crazy, and then goes all the way through your thorax. I don't want to get too into innervation, but it's going to provide innervation, parasympathetics, your rest and digest system, to your heart and lungs, and it is also to the arteries and stuff like that. And then it's going to supply the parasympathetics to your esophagus, and then vagus goes behind the diaphragm with the esophagus and goes to all your digestive organs and does crazy stuff up to a certain point in digestion. We'll get there when we get there, but it's awesome. Vagus means wander. So this is the wandering cranial nerves, because holy crap, it goes everywhere. It's crazy. So that's vagus. This is left vagus and right vagus. One little tidbit you can know about them is when you're developing, they kind of rotate around. So your right vagus nerve is more posterior, harder to find, whereas your left vagus is more anterior. So it's easier to find that recurrent branch. One, because you can just look for the arch of the aorta, find your ligamentum arteriosum, and you're golden, and look for it looping under, but also because it's more in your face. So that's vagus nerve and its relationship to the aorta and the pulmonary trunk and the ligamentum arteriosum. The other structure, before I get to the vein, because the vein is one of the deepest structures, the esophagus is also very deep. All of this is behind the heart, remember. One of the things I want to bring up is the larynx produces sound. It's how I'm speaking right now. Thyroid gland is a gland in your neck you don't need to know about yet, but this trachea here is my air tube. Essentially how I'm bringing air into my lungs is through my trachea. My trachea comes down and splits. Got cartilaginous rings. That's usually how people identify it. You can definitely feel it in lab, that cartilage, if you stroke your trachea. I hate the words I say sometimes. And then it's going to split into bronchi. So this is a main or primary bronchus is the singular, bronchi is the plural. This is the primary bronchus. And this would be my left and my right. So we have a left and a right primary bronchus. Those are going to go into the lungs because you have to get into the lungs to give them air. And they're going to separate into lobar bronchi and then segmental bronchi, which we're not going to get into in this video. But they're going to tree out like the branches of a tree until they reach the leaves, which are those alveolar sacs where they can do oxygen exchange. Those are going off into the lungs, is my point. And the lung would be about here. And when you cut your lungs out, you cut your bronchus. So that structure is underneath your aorta and your pulmonary trunk and your superior vena cava, and you should find it and be able to identify it because it does exist there. And when you find this thing, what you're going to find is big, fat, weird structures that are actually lymph nodes. This is where you'll find a lot of lymph nodes, a lot of hilar lymph nodes, the hilum of the lung, where all of those structures go in and out of the lung. It's called the hilum. I have another video about that. These are lymph nodes, so don't be afraid if you find a bunch of stuff there. That's usually lymph nodes. This is also where we find a lot of lymphoma when we're dissecting. A lot of inflamed, very large or cancerous lymph nodes. in this region. So you're going to have to peel those off. Don't be afraid to peel them off so you can see your bronchus and its tree. Okay, didn't want to move on without mentioning that. Now I want to talk about our azygos vein. So our azygos vein is a very important structure. Everybody hates it. Thanks for watching. Don't forget to like, share, and most importantly, subscribe to the channel. The next video is covering those posterior veins of the thorax. Toodaloo.